Today's topic is the wrist joint. So, this wrist joint is normally presented between the forearm and the hand. And coming to the type of the joint, it is the ellipsoid variety of synovial joint. And the articulation surface, as we know, so this is the uh, radius bone and ulnar bone, and these are the wrist bones such as scaphoid, lunate, and tricotal bone. So here the articulation surface are the inferior surface of the radius bone, and we have know that we have a superior and inferior radioulnar joint. So here the inferior radioulnar joint is involved. This is the upper surface, upper end articulation surface. Coming to the lower end articulation surface, the proximal surface of the scaphoid bone, lunate bone, and tricotal bone are involved. Coming to the important point, the ulnar bone and the pisiform bone does not involved in the formation of the articulation surface of this particular joint. Coming to the ligaments are the radiocollateral ligament, ulnar collateral ligament, and palmar radiocarpal ligament, ulnar carpal ligament, and posteriorly we have dorsal radiocarpal ligament. And normally we have in all these joints the capsular ligament. So these are the ligaments which is presented in the wrist joints. Coming to the relations, see normally this is the radius bone, articulation surface of radius bone. In radius bone we have lateral ligament, medial ligament. Okay, so coming to the relations, first we will see the posterior relations as well as the lateral and medial. So coming to the lateral relations, we have first a compartment of the extensor retinaculum. So as we know, in the wrist only, at the back side we have extensor retinaculum, at the front we have flexor retinaculum. So all the contents of these retinaculum will be presented as a relations with the wrist joint. So this is the first compartment of the extensor retinaculum, and this is the second and third, and we have fourth compartment and fifth compartment and sixth compartment. So these are the content of the compartments of that particular compartment. So we have 6 compartments in the extensor retinaculum. Extensor retinaculum is presented in the back of the wrist joint, as the posterior relations of the wrist joint is the extensor retinaculum compartments. So in the first compartment, adductor pollis longus, extensor pollis brevis. In the second compartment, that is radialis muscle, that is extensor carpi radialis longus, extensor carpus radialis brevis. The third compartment, extensor pollis longus. In the fourth compartment, anterior interosseous artery, posterior interosseous nerve, and extensor digitorum and extensor indicis. Coming to the fifth compartment, extensor digitorum minimi, and in sixth compartment, extensor carpi ulnaris. So these are the posterior and lateral relations of the wrist joint. Coming to the anterior relations, as we know, in the front we have the flexor retinaculum. So in flexor retinaculum, deep to that flexor retinaculum we have flexor digitorum superficialis, flexor digitorum profundus. These are the 2 tendons, and we have palmaris longus. Uh, as we know, the flexor retinaculum have the superficial structures and deep structures. Coming to the deep structures, we have all these: flexor digitorum superficialis, flexor digitorum profundus, and palmaris longus. And coming to the superficial structures, we have flexor carpi radialis, flexor carpi ulnaris, and deep structure we have include median nerve. And again, these are the structures of the flexor retinaculum. And we have some other extra structures which is presented around the wrist joint is the ulnar artery and radial artery. So ulnar artery is medial side, radial artery is lateral side. So these are the relations of the wrist joint. To the movements of the wrist joint, we have flexion, extension, adduction and abduction. So normally the flexion is done by the flexor muscles, that is flexor carpi radialis, flexor carpi ulnaris, palmaris longus. So coming to the extension, extensor muscles will be involved. Extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. So extensor muscles will be involved. Coming to the adduction and abduction, adduction is towards the medial side of the body. So medial side bone is the ulnar bone. So ulnar muscles are involved. In the sense, flexor carpi ulnaris, extensor carpi ulnaris are involved in the adduction. Since adduction is towards the medial side of the body, so medial side bone is the ulnar bone is presented. So the ulnar muscles, in the sense, flexor carpi ulnaris and extensor carpi ulnaris are presented. Coming to the abduction is towards the lateral side. So radius muscles are involved. In this sense, flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, and abductor pollis longus. So these are the muscles involved in it. So coming to the movements, this is the flexion. Flexion in the sense, the downward movement of the hand. It is the upward movement of the hand. So the abduction, so this is the axis. The action is towards the medial side of the body, which is referred as adduction. So this adduction is also known as radial deviation, whereas abduction is known as ulnar deviation. So these are the main actions of the wrist joint. Coming to the clinical aspects of the wrist joint, first is the Colles fracture. So this occurs due to the fracture in the distal end of the radius. So this is the radius bone, this is the ulnar bone, these are the wrist joint bones. So there is the fracture in the distal part of the radius bone, which is referred as Colles fracture. And coming to the ganglion, so this ganglion is nothing but the cyst, the non-tendinous cyst, which is formed in the dorsal aspect of the arm. Normally when the flexion of the wrist is done, the pain maybe arises in this cyst or the ganglion. So then coming to the aspiration of the wrist joint, the needle is inserted just below to the styloid process of the radius, and the any collections of fluid or pus is aspirated. Then coming to the osteoarthritis is nothing but the when normally the joint is the joint articulation surface is covered by a tissues or fibrous band. When this get damaged and the bones get rubbed to each other, and it causes the osteoarthritis, degenerative of the tissue in the joint. These are the main applications of the wrist joint. Thank you.